Hi, so today I'm going to talk to you about PCOS, which is short for Polycystic Ovarian Syndrome. So, PCOS is a hormonal disease that affects women of the reproductive age, and the most common symptom is having infrequent or irregular periods due to excess male hormones, such as androgen. So what actually causes PCOS? Right now, there are no known causes for PCOS. However, it is strongly associated with obesity. What happens when you actually have PCOS, or the science behind it, is that the ovaries develop small collections of fluid called cysts and fail to release eggs, which results in the abnormal periods. So in terms of symptoms, these symptoms vary. However, the most common is having irregular periods, and this means that you either have them infrequently, or they're prolonged, or they're just irregular. So, for example, having less than 9 periods a year, or having more than 35 days between each period, or just having heavy periods in general. Another symptom is excess androgen. And excess levels of this male hormone manifest, or they have physical signs where you have excess facial hair or body hair, and in extreme cases, male pattern baldness. Lastly, polycystic ovaries, and this is what we talked about before, which is the enlarged ovaries, and these contain follicles surrounding the eggs. Complications and statistics. So there are a lot of risks or side effects to having PCOS, essentially, and some of these include infertility, type 2 diabetes, depression, abnormal uterine bleeding, or miscarriage and premature birth. And so to put this in context, PCOS affects 1 in 10 women, where between 2.2 to 26.7% of the women aged 15 to 44 have PCOS, and up to 70% of women with PCOS haven't been diagnosed. In terms of treatment, there's no known cure for PCOS. However, there are various medications that can help manage the symptoms, or lifestyle changes. So the first or most common is a lifestyle change, and it's recommended that you exercise and eat healthy regularly, because this helps with weight loss, and it helps thereby manage your periods. Also, regulating or managing your sugar intake, because PCOS is known to cause high blood sugars, so just regulating your sugar intake can help. Another common one is birth control, and this is the most common for women who don't want to have children, because it just helps with your period regularity. And lastly is just medication or various gels or creams that can help with the excess hair growth, and so creams and gels that just help break down the protein structures of these hairs so that they just fall off the skin or fall out of it. So before I go, I just want to say, if you feel as though some of your symptoms match, please don't take any medication or self-diagnose without talking to a doctor first. And I just want to say thank you for listening.